Serena Williams, the 23 Grand Slam winning tennis champion, an inspiration to millions around the world, dead at age 35. Cause of death, a blood clot in her lungs that she contracted after childbirth. Now, the doctor said that there was absolutely no sign of a blood clot until, wait a minute, that's not how the story goes. For Williams apparently alerted nurses of extreme discomfort in her chest, and she requested for a CAT scan numerous times. And the nurse's response, I think all that medicine is making you talk crazy. Now, luckily, this isn't how the story goes. For Williams finally got that CAT scan, and lo and behold, it saved her life, as according to an interview published by Elle magazine in 2018. But think for a moment. If someone like Serena Williams had to beg for a CAT scan that saved her life, then imagine how it's like for the everyday Black woman. According to a CDC statistic published in 2021, Black women are 3 times more likely to die from pregnancy-related causes than white women, and they have the most maternal deaths out of all POC women in America. And my mother, an African-American midwife who has been practicing for over a decade, can tell you all about the veracity of this statistic. For she says too many times she has to save Black mothers from their demise because of the inadequate care that they receive from her peers. And unfortunately, there won't always be people like my mother who will save the day or maybe even save you if you decide to start a family. So based off of my research, there's an evident disparity in the amount of Black maternal deaths in America. The factors I'll be discussing are the presence of implicit bias, institutional racism, and non-inclusive Medicaid. So let's first start with implicit bias. According to a testimony provided by my mother, she states that she works at a hospital in an impoverished area filled with a plethora of patients. And so with that, she tells me of the constant ringing of emergency codes and how doctors are constantly on their toes, going from patient to patient, all while doing it cautiously and efficiently. Also common to these areas is the concentration of Black women who live there. For according to a 2021 statistic published by the Center for American Progress, it states that 22.3% of Black women live in poverty. So with almost a quarter of Black women going to these hospitals in these impoverished areas, we can see the negative effects in their health care. For with so many patients, doctors don't have the time or the empathetic nature to give the best quality of care to Black mothers. A comforting atmosphere must be established in order for any patient to feel comfortable in addressing their concerns to their doctor. But when a Black woman sees that her doctor is too busy and can't even take time to sit down and get to know her story, then she'll deem it's unnecessary to voice her concerns. And so being more likely to receive inadequate health care isn't where this problem stops. For we even see, and it's also even worse to hear, that African American women already face a higher risk when it comes to giving birth because of the existence of institutional racism, which I'll be talking about next. First, we'll be talking about the effects of redlining. The National Institute of Children's Health website, last access in 2023, states that this was a process in the 1930s that refused secure mortgages to areas that were predominantly Black, leading to the shutting down of important facilities like hospitals, grocery stores, and health clinics. And yes, this process is illegal now, but you still see the effects today, for these areas still don't have nearly as many health clinics as affluent neighborhoods, and they're more prone to be economically disadvantaged. Another aspect to institutional racism is the effects of generational trauma. In an article published in 2020 on the National Women's Health Network website, it states that during the Jim Crow era, selective reproduction was a primary motive in performing thousands of unmerited hysterectomies on Black women, with doctors such as Marion Sims performing these procedures without anesthesia. And so with these horrific statistics and stories, this has inevitably caused Black women to be more distrusting of doctors before they even step foot into a hospital. And so now we're looking at fewer institutions, less money, and greater mistrust amongst doctors. So even with all that I said so far, you may be thinking, well, why aren't Black women just more assertive in their doctor's visits? But what if they can't even afford to take that step? And yes, you may point your fingers to services like Medicaid, and it has helped 65% of Black women, according to a 2000 study published by We Journal. But its policies are nearly as inclusive to help all the lower income Black women who need these benefits. According to Medicaid's policies, you can only avail yourself to it if you are 133% below the poverty line. This means that there's a plethora of Black women who need the benefits of Medicaid, but they simply don't qualify. And so no insurance means missing out on prescriptions, screenings that can detect early health complications, and tracking the health of your unborn child, leading to that CDC statistic that we saw earlier. And so now that we know that this disparity against Black mothers exists, we know that it's not just an issue, it's a public health crisis. So it's not enough just for us to actuate this problem, we need to take action. And so I'll be talking about some wide-scale initiatives and some personal scale initiatives that we can leave within this room to combat this statistic. First, we can implement a required class in medical and nursing schools that's centered on the omission of implicit bias. Its curriculum will teach healthcare providers about common stereotypes and how these stereotypes harm the health of the patient. With the ridding of these stereotypes, the class will further go in depth on communication strategies that allow a close relationship between doctor and patient, allowing for comfortability to be established and to know the knowledge of a patient's struggle. Next, we can advocate for legislators who want to expand the qualifications of Medicaid. As of now, the Center of Disease Control and Prevention released in 2022 that out of 100,000 deaths, 44 Black women die. However, the American Rescue Plan Act combats this statistic by extending Medicaid benefits 12 months after birth and extending the qualifications of Medicaid. And according to a 2021 study published by USC, the study found that among 32 states that took on this act, they saw 12 fewer deaths than Black women per 100,000 births, showing how it is very effective. Next, what we can do as individuals is educate ourselves and our loved ones about this vast disparity, especially if they're a childbearing Black mother. For by educating ourselves and spreading awareness, Black mothers are more knowledgeable about their increased risk and thus preventing them to be part of that statistic. For they know the symptoms of early health complications and they know the signs of malpractice. And also what we should do is that we should be a circle of support for these Black mothers and support them when they address concerns about their health and not make them feel crazy about it. And yes, you may think these are simple steps, but they are grand. And the fact that Black women are better equipped in their rebuttal against implicit bias and malpractice. So today, we all gained some insight about the extent of the Black maternal mortality disparity and how we can fight against it. We did this by learning the components of this disparity and some wide-scale and some personal-scale initiatives that we can all take. By educating ourselves, we can better understand not only how to improve the conditions of motherhood for Black mothers, but the conditions of motherhood for all in this country. And so it's time that we break this recurring trial, and that can only happen by the support of each of you in this room. So I urge you all, as of today, break the curse and save the Black mother.